Morning, team.
Morning.
Morning, everyone. Have a nice weekend.
Yes, thank you.
Good. Okay. Well, we've got a busy day today, as usual. I think we all know each other, apart from Cass, who's new to the team. Has everyone met Cass before? Why don't we introduce ourselves for her benefit? So I'm Alistair Lindsay, the cardiologist.
I'm Paul, charge nurse.
Sylvia, circulating nurse.
I'm Jenna, the radiographer. I'm Cassie, the tech.
Well, welcome.
Yeah.
So Mondays are always a busy day. We've got 4 listed cases, but I've actually had a phone call from our local referring hospital about 4 other emergency cases. So first of all, what 4 patients have we got listed, Paul?
Alright, so first one's Mrs. Jones. She has a latex allergy.
Okay, so we're doing her first. Fine. I don't think there's any other complicating factors there, are there?
Not that I'm aware of.
Okay, so I think she'll probably need 1 stent to the LED, and then we can get on with the rest of the list. Who's next?
Next is Mr. Smith. He's familiar. He's been here before, hasn't he?
Yeah, he's quite a complex case. The last one we did was about 2 hours long, and I think it's going to be the same again. He's one where he's got a long segment of calcific stenosis, so we might need the rotablator. Cass, so if you could just make sure that's ready, that would be great.
Yep, I'll make sure it's in the room.
Okay.
Yeah. Should we bring the balloon pump in as well?
Yeah, it's definitely. It's always
I'll take
safer to
that
have
up.
it here.
Alright, next one, Mrs. Patel.
Mm-hmm.
I understand she's had extensive back surgery.
Yeah.
Do you want me to have the morphine and midazolam straight away, or do you want to wait and see how we go with positioning?
That's a good idea. Why don't we give her some midazolam to start with, and that might make her more comfortable on the table.
Alright. And then the 4th one, Mrs. Johnson.
Okay, so that's the patient where we said we would use the intravascular ultrasound machine. So that's the second bit of equipment we'll need, but not till later on today.
Okay, yeah.
Cool. Thanks for digging that out. So there's 4 other cases that I got called about. One of them's a treat and transfer, which means we'll have to try and get them in, do the case, and send them back to their hospital. That's a 58-year-old male with a first episode of chest pain. Then the second patient is a young lady who had some atypical pain, but I think needs a diagnostic angiogram. She's upstairs in the ward and is getting clerked just now. And then there's 2 more acute coronary syndrome patients who are coming across later in the day. I think probably best we rebrief on those at lunchtime once we know a bit more details about them.
Okay.
Alright, should we organise to have a bed on the ward available just in case we can't get them back in time?
I think that's a really good backup, yeah. The other thing we should do with these patients we don't know so well is just make sure that when we go through the checklist, the sign-in bit is signed off so that we know we've been through all the safety checks before we start. Okay, great. I think that's all I've got to say. Anybody got any other questions?
Do you want contrast in the pump for the first patient?
Oh yes, Mrs. Jones. Yeah, I think that's a good idea. We'll probably end up doing a ventriculogram, so let's do that.
Okay.
Great, okay. Well, in that case, let's get started.
Alright,
Great.
brilliant.